Hey everyone, welcome back to Shalonda's Nursing Corner. If you're new here, I'm a registered nurse and this is part 7 of our Pharmacology Series. So far we've covered part 1, pharmacokinetics, pharmacodynamics, and medication rights. Part 2, drug classifications and common medications. Part 3, medication safety and nursing interventions. Part 4, medication calculations and dosage conversions. Part 5, drug interactions and contraindications. Part 6, medication errors and adverse drug reactions. Now, in Part 7, we're breaking down medication administration routes, how different routes affect drug absorption, effectiveness, and patient safety. Stay until the end for a quick quiz to test your knowledge. Let's get started. A medication administration route is the way a drug enters the body. Each route affects how quickly the drug works and how much of it reaches the bloodstream. There are 3 main types of administration routes. 1, enteral through the digestive system, includes oral, sublingual, and rectal routes. 2, parenteral by injection, includes IV, IM, and subcutaneous routes. 3, topical, applied to the skin or mucosa, includes creams, patches, and eye drops. Let's break them down. Enteral routes go through the GI tract. They are common, but absorption can be slower than injections. Oral PO, swallowed and absorbed in the stomach intestines. Example, acetaminophen tablets. Nursing tip, some meds should be taken with or without food. Check the instructions. Sublingual SL, placed under the tongue for fast absorption. Example, nitroglycerin for chest pain. Nursing tip, do not chew or swallow SL medications. Buccal, placed between the cheek and gum for absorption. Example, fentanyl buccal tablets. Rectal PR, inserted into the rectum when oral isn't an option. Example, acetaminophen suppositories for fever. Nursing tip, great for patients who are vomiting or unconscious. Parenteral routes involve injections or IV administration. These work faster than oral meds but require proper technique to avoid complications. Intravenous IV, delivered directly into the bloodstream for immediate effect. Example, morphine IV, push for severe pain. Nursing tip, watch for infiltration, fluid leaking into tissues, and phlebitis, vein inflammation. Intramuscular IM, injected into the muscle for fast absorption. Example, flu vaccines. Nursing tip, use the Z-Track method to prevent irritation. Subcutaneous SC or SQ, injected into the fatty tissue for slow absorption. Example, insulin injections. Nursing tip, rotate injection sites to prevent tissue damage. Intradermal ID, injected just under the skin for testing purposes. Example, TB skin test. Epidural and intrathecal, injected into the spinal space for pain management. Example, epidural anesthesia during labor. Topical medications are applied to the skin or mucous membranes. These can be localized or absorbed into the bloodstream. Transdermal patches, absorbed through the skin over time. Example, nicotine or fentanyl patches. Nursing tip, rotate patch sites to prevent skin irritation. Creams, ointments, and gels used for skin conditions or pain relief. Example, hydrocortisone cream. Ophthalmic eye drops, used for eye infections or glaucoma. Example, timolol for glaucoma. Otic ear drops, treat ear infections or wax buildup. Nursing tip for adults, pull the ear up and back when administering. Nasal sprays and inhalers, used for allergies, asthma, or congestion. Example, albuterol inhalers for asthma attacks. Nursing tip, have patients rinse their mouth after using steroid inhalers to prevent thrush. Nurses must choose the right route based on the patient's condition and drug type. Ask yourself, how fast does the medication need to work? IV is fastest, while oral takes longer. Can the patient swallow? If not, try IV, IM, or rectal routes. Is the medication affected by stomach acid? Some meds work better sublingually or via injection. Is there a skin infection? Avoid topical meds over broken skin. Nursing tip, always check facility protocols and drug instructions before giving meds. Let's see what you've learned. I'll ask a few questions and you'll have a few seconds to think before I reveal the answer. Question 1. Which route delivers medication directly into the bloodstream for immediate effect? Answer: intravenous, IV. Question 2. What's the best route for a patient who is vomiting but needs fever-reducing medication? Answer: rectal, PR suppository. Question 3. A nurse is administering eye drops. What should they do first? Answer: pull down the lower eyelid and avoid touching the dropper to the eye. Question 4. What's the slowest route of medication absorption? Answer: oral PO. And that's a wrap for part 7 of our Pharmacology series. Today, we covered enteral, parenteral, and topical medication routes, how different routes affect drug absorption, nursing considerations when choosing a route. In part 8, we'll talk about controlled substances and drug regulations. If you found this helpful, don't forget to like this video and subscribe so you don't miss the next one. Thanks for watching Shalonda's Nursing Corner. See you next time.